Good morning. I am Dr. Manasi Godbole. I am a practicing ophthalmologist, and today's video is going to be a little longer because we are at the end of World Glaucoma Week this year. So glaucoma, as we all know, it's a potentially blinding disease. Intraocular pressure or eye pressure is the main causative factor. So many a times the eye pressure is raised beyond a normal limit in glaucoma patients. The normal limit of eye pressure is 10 to 21 millimeters of mercury. But also remember, there is a variety of glaucoma which is called as normal tension glaucoma, where the eye pressure is normal but still there is optic nerve damage. This optic nerve, which is the back portion of the eye, this is the optic nerve. So when the eye pressure is more, the fluid pressure inside the eye is more, it compresses the optic nerve which goes to the brain. Optic nerve damage is a permanent damage. It cannot be replaced or reversed. So early detection of glaucoma is very, very essential. Everyone above the age of 40 should get their eye pressure checked at least once in a year from an ophthalmologist. So there are certain risk factors to glaucoma. One is family history. If somebody is in the family suffering from glaucoma, you are predisposed to develop glaucoma. So family history, use of steroids in any form, may it be an skin cream or tablet or inhaler for asthma. So steroid is the second risk factor. Third is diabetes. Fourth is hypertension. Fifth is trauma to eye in any form. And sixth risk factor is high spectacle number. So people who have these risk factors already, they should get their eye pressure checked even before the age of 40. Then coming to the symptoms of glaucoma, many times there are no symptoms, there is no pain, there is no vision loss in the early stages of glaucoma. There are two types of glaucomas, one is open angle and one is angle closure. So many times open angle glaucomas don't have any symptoms. Angle closure may have symptoms like pain in the eye, reduced vision, redness, photophobia. So again, importance of getting your eye pressure checked. So behind me there is a photo of eye of a patient who had secondary glaucoma, a different rare variety of glaucoma where the patient presented with pain and redness and the eye pressure was above 40. So these are certain rare types of glaucoma. Many times the patient doesn't have any symptoms. Then coming to the tests of glaucoma, so there is battery of investigations which we carry out in a patient of suspected glaucoma. So I have prepared this sheet wherein I have written all the tests for glaucoma. So they are carried out in suspected glaucoma patient. Secondly, to diagnose glaucoma in early stages. Then to stage glaucoma, if we have diagnosed a patient with glaucoma, then to stage the disease and plan further treatment. And fourth is to monitor the stability or progression of glaucoma in a patient who is already under treatment. So coming to this tests, the first important test is called as intraocular pressure measurement, and for which we use two types of tonometers. One is called as non-contact tonometer, which I have in my basic examination room. It is used for screening. So my assistant will check pressure on NCT or non-contact tonometer. If she finds it on the higher side, then I will confirm the pressure on applanation tonometer. So this is a slit lamp. And on the slit lamp biomicroscope, I have this applanation tonometer. This probe, so this applanation probe is going to touch the patient's eye, and that's how we calculate eye pressure. So again, as I told you, the normal range of eye pressure is 10 to 21 millimeters of mercury. Then the second test is called as gonioscopy. Gonioscopy is to know the type of glaucoma. So this tiny instrument in my hand is called as a gonioscope. This is a lens through which I am going to see the inside of the patient's eye. What is the angle? Angle is the structure which is in between the iris and cornea of the patient. So through angle, the intraocular fluid will get drained out. If the angles are narrow, the patient may develop angle closure glaucoma in future. So the second test which we saw is called as gonioscopy. The third test is called pachymetry. So I have a pachymeter over here. It's an ultrasound based pachymeter which is going to give me thickness of cornea. Cornea is the front portion of the eye, and there is a correction factor if pachymetry is on the higher side or the pachymetry is on the lower side. We have to add or subtract certain number from the eye pressure which is tested. It's a bit complicated, but just remember, third test is called as pachymetry. The fourth test is called as perimetry, and perimetry is to check the peripheral vision of the patient. So I have a tiny perimeter which is the new instrument. It is called as virtual reality based perimeter. So I have to put this like goggle, and inside I am going to see light which is called as a target light. So the patient is supposed to look at the target light, and there will be small lights which will flicker in the periphery. So once the patient perceives those tiny lights flickering in the peripheral part of the perimeter, he has to press the button. So this test is simple. It is like playing a video game, but patient needs to be attentive and concentrate during this test. So why perimetry is important? Peri is peripheral and metry is to measure. So this perimetry is to measure peripheral visual field of the patient. So when optic nerve starts getting affected due to glaucoma, the central portion of the optic nerve gets affected. Central portion of the nerve is responsible for peripheral vision. And once the peripheral vision is affected, actually we see with both eyes together. So if I am seeing a little less in the peripheral field of my right eye, the left eye is also going to see that field. So the other eye will compensate. So there is no way patient can know early visual field loss in glaucoma. So perimetry is very, very important. Then the next fifth test is called as fundus photograph and optical coherence tomography scan. So this machine which I have here, it will give me picture of the optic nerve. We see certain signs while examining the optic nerve of the patient. So this is an actual photo. So this is like baseline record. If I have this photo and the scan of the nerve with me, when the patient will come for follow-up, I am going to compare that day's findings with this baseline report. So this is again very essential. This is called as optical coherence tomography of the optic nerve and photograph or fundus photo of the optic nerve. So these are all the tests that we carry out in glaucoma patients. Now coming to the treatment. So treatment comprises of mainly eye drops, lasers and surgery. So different treatments are given at different stages of the disease, and we may combine the 2 or 3 as per the stage of the glaucoma. So timing of eye drops is very important. If I tell my patient to put drops at 9 o'clock in the night, then he has to put it at 9. 10-15 minutes leeway is there, but not beyond that, because timing is essential. Like we have timings, strict timings for antihypertensive drugs or medicines which control blood pressure. So timing of eye drops is very important. There are certain lasers, different lasers for open angle glaucoma, different lasers for angle closure glaucoma, and there is glaucoma surgery which is called as filtration surgery. Again, there are a lot of advances in that. Let's not discuss, but just remember eye drops, lasers and surgeries are the mainstay of treatment in case of glaucoma patient. Now, a very important part again to summarize, glaucoma is called silent thief of the eye. The patient many times doesn't have any symptoms. So please get your eye pressure checked from an ophthalmologist at least once in a year. So by the time patient develops symptoms, it is many times already late. The patient has already developed optic nerve damage, there is visual loss, and then we are left with very less choice of treatment. So prevention, early diagnosis and timely treatment of glaucoma is essential. Get your eye pressure checked today itself and take care.